First sound.
99.9 WEFM.
WhatsApp us or call us at 457-9997. Activated Mornings on WeFM 99.9 is on now.
All right, in time here in SVG, it is 8:43, and we are back with you for another commentary segment of our Activated Mornings program. In studio, you have Dianna, Cain, and myself, Roleza, Samuel, and we are going to jump into another topic at this time.
The book.
All right, so yesterday, I'm not sure how many of you remembered or were aware, but yesterday was World AIDS Day. All right, so every December 1st, we celebrate or recognize World AIDS. I have to ask the question, are we doing enough, or are we even being serious about the recognition of this day? All right, I noted from my end that I didn't see anything with regards to it. Right, I didn't see any, let's say, social media blast. I did not see anything in the newspapers. I did not see anything that was visual or that was there standing out. And honestly, I forgot that yesterday was World AIDS Day, right? And part of me wonders, is it a case where we do not necessarily pay as much attention to the significance of this day? Now, reading from Loop News, that they're saying that approximately 100,000 people are living with HIV and they are not accessing life-saving antiretroviral therapy. All right. Some of the reasons given are that there are some persons who might be stigmatized with regards to trying to seek access. Some persons don't even know that they actually have the HIV virus. All right. And for whatever reason, persons do not want to go and get tested. I note a lot within social media, you know, this whole trend of bun for bun and butt for butt. And, you know, this whole thing of well, I used to call them spare tires, you know, when your relationship isn't working, you can jump to
The
somebody
side
else.
pieces,
The side pieces, right.
nibbling.
See, all of that, those terminologies, all right? And part of this also does contribute to the prevalence and the spread of HIV and then becoming full-blown AIDS. And before we've raised this question here on this program in terms of targeting the young persons in particular, because from another source that I read a few months ago, that it's actually younger persons who are being diagnosed with HIV, right? What is actually being done to get the message directly to them?
Well, I suppose they don't want to receive the message because since I was a child, Roleza, I know about HIV and AIDS. Since I'm growing up, I'm hearing they used to have this ad. Yes, I know.
I remember
But
that.
wasn't it? They had a bunch of artists. They had the ad. Do you know your status? Everybody, I know. Yes, I know. Yes, I know.
Yeah, no, the one that I remember has to do with the patois when you say macro misape that. That is the one that I remember. And she says hour afterwards. Don't know what it's saying in English, but that's the one that I remember. Okay. All right, so we have Doc joining us this morning. Doc, morning.
Hi, are you hearing me?
Great. We are. Let's go ahead. Let me hear you.
Yes, really. Now, folks, I am in Thailand. Gorgeous.
Robertson.
I was in Bangkok. Now I'm in a rural city. That's amazing. A spiritual city. I'm just in awe. I mean, now I'm a Christian. I am not going to transform to Buddhism, but I tell you something. These people have faith. But you're absolutely right. I suppose people know I'm an infectious disease specialist. I've treated AIDS patients since the late 80s. I've traveled to Kenya. I've traveled to Nigeria. I've traveled to a lot of different parts of the world in relation to this disease. Let me say that you all are absolutely right. We are seeing some trends, but there are some worrying trends out of Africa. I think that because of the skepticism, you have places like in Lesotho and a number of places in southern Africa in which 1 in 5 persons, adults, are infected with HIV disease. Imagine that, 1 in 5. And the Caribbean, basically, it doesn't have those extremely high rates, but because of the size of our population, we do have some alarming statistical numbers. I think that when you celebrate World AIDS Day, it's just for today. And for the rest of the year, there isn't much on it. Really, so Dianna, we're not going to talk about this until next year again.
Mm.
And science has proven that you need a constant reminder all the time.
Yep.
I can tell you some strange things. I remember in the 90s when practicing, I was stuck by a needle. And I tested myself every single month for 2 years. You know? Now, we've now gotten sophisticated medicines that can suppress the virus to a level, believe this or not, that you're no longer infectious to that degree. And when we used to think that HIV was a death sentence in the 90s when I practiced, we now know it's no longer a death sentence. It's like chronic disease. As a matter of fact, you may well die of diabetes and hypertension before you die of AIDS. I got to say it that way. If you are on therapy. Now, if you're not on therapy, your health will fail. And this is it. For people who are not testing, the HIV virus is working. It's infecting your white blood cells. It's infecting
Doc?
your...
And
Yeah?
the internet.
People-
You hearing me? Are you hearing me?
Go ahead. Go ahead now.
And it's really wreaking havoc on your health. So by testing means you can start treatment early. And this treatment can suppress the virus so that it is not having the same type of effect if you're not taking. So being tested is critical. And the HIV unit, they're doing testing. They can do rapid tests. They can do comprehensive tests. It's important that people know their status, not just for today and thinking, well, you're all right, but checking it next year again, just like you're doing a routine exam.
Next year, every 6 months, Doc.
6 months, whatever your particular habit is, don't be afraid of being tested. And I think that the stigmatization, because people are still worried about information getting out and everything like that, but it's so critical that your partners, their lives can be in this regard. I have to say partners because these are sometimes the fact of it's not just the persons you are having a sexual relationship with, but the person who you're with may be having other relationships too. So
And that is the frightening thing. That exactly is what is most frightening.
yes.
You did with your good and boops, you hear some kind of news about you have this or you have that, knowing that you did not contribute to
Yeah.
it. That is what's frightening, Doc.
And I know there may be calls, but I want to say something very important. When I practiced actively, I was surprised about individuals. Their husband or their wife were positive, but they were negative. And I would test them every 3 months, 4 months, and after 2-3 years, they were still negative. We now know that there are genes that actually protect you from catching the HIV virus. And if you have 2 of the genes, you are well protected. If you have one of the genes, therefore, your catching the virus can be delayed significantly. So guess what? You may well show up positive for a year and a half or two, you know, but at least having the gene is going to limit the way in which the virus basically progresses. And it's good to have two. So this is a recent discovery, and it's the same gene as what protected some people against smallpox. Another virus called smallpox. So all is very fascinating science information, but the important thing is be tested, get early treatment, and guess what? There are medications we have today for individuals. If you suspect that you may have gotten exposed, we can give you something called PrEP, a PrEP medication that can help to prevent you from actually contracting the virus even after exposure. You know, it's a lot like if you're pregnant and you take the morning after pill and so forth, because you want to make sure that could
You mean
also
before you, Dr. Thompson, before you're pregnant?
Before you realize you're pregnant.
Before said
before you
after the
realize.
deed. After the deed.
So guess what? There's some people who are with a partner who's positive, but they love that person and they have a relationship. They may not necessarily wear condoms, and so which they should. You know, somebody may advise them break up with the person, but if they're not, you know, then they basically can take PrEP, which will eliminate or significantly reduce by 99% the risk of actually pick up the virus. Very interesting stuff, you know.
I noticed on the SVG Health page, there were two posts, and one of them related to testing. This was on the 24th of November. It was posted on the 24th of November. And they were doing free HIV and syphilis screening. They did it at community college, as well as the Villa campus, Technical College campus, well, Annisville campus and Diamond campus. You know, which is interesting because they're doing these tests. But I have to wonder how much more is being done to actually target young persons. Why is it that is it a case where the budget has fallen off in terms of marketing with regards to this? What exactly has been, or do we just say something going to take care, and if it's HIV, then it's going to be HIV?
Me, I for one think that a lot has been done. I think that a lot of information is out there. This thing that you saw with free testing, I have to admit that throughout the year, I do see quite a number of those things, whether one organization, this group or that, doing something and they have free HIV testing. There's a lot that is happening. I know that clinics used to give you condoms for free. I don't know if this actually, I spoke with some persons the other day and they mentioned to me one clinic that right next to them that actually still gives out free condoms. Several places around the country you can get free condoms as well. Condoms are sold. Pharmacies in Kingston, people know this. You know that they have this particular pharmacy in town that they even make that joke about. They say late at night, that's where that is open and they could save their life to go and get.
But then if that is the case, then what is the reason for it contributing? The HIV stats keep going up, especially amongst young people. If all of this information is out there, if everything is so accessible, then how is it still increasing?
I don't know. It's the same way we know all about crime and violence and we know the consequences, but we're still killing and doing whatever. I do not know. I really think that we have a lot of information and people know they just don't care for several reasons. People have this thing to this day and age that is, I find strange, that they believe that if you have HIV or any other sexually transmitted infection, that you're going to look sick. In this 2024, there are persons who still believe that if you have HIV, they could tell by looking at you. And it's repeatedly been said, you cannot tell if someone is sick by looking at them. So, and interesting to note, the Caribbean is the second most affected region with HIV after Africa.
Yep.
And the majority of new HIV cases are young women between 20 and 24, and in the males, the 40 to 49.
40 to 49?
Yeah. That's what the statistics
That's some
told
interesting
me.
stats, but I won't say what I'm thinking on air based on how you presented those stats.
I
but
probably take the very same thing.
Yeah, that is interesting.
Yeah.
Listen, I tell you, when I went to Kenya, the men went to the port, which was miles away, to work. They dealt with prostitutes and they came back and gave the HIV to their wives, you know? And we travel. People travel. I'm not going to say anything about who, but I should say there are sailors. There are people who travel for work, whether it's forestry or whether it's working abroad. And because their significant others not with them, they may well indulge with prostitution. A person may use a condom 90% of the time, but they may not use it on occasion. You know what I mean? So people are aware, but that age group, we were just thinking it's just youth that is the fast growing, and then this other age group. My area of study was HIV in the elderly. In Newark, New Jersey, I had 60 patients over the age of 60 who had contracted HIV disease. So no age group is basically beyond. It's really practice, the type of practice, who you are involved with, and who your partner may well be involved with too. And it's just one of those. But a special appeal must be made, as you said, to young persons, because we feel, they feel, I was going to say, we feel immoral. But they feel, as if nothing will happen. But really, they are scared, but they are also scared to ask. They're scared to raise those particular questions, and relationships and so on. The difficulty in their own way. But really, it's something that we got to press on and talk about a lot more. So it's not just one day; it's every day.
Agreed. And you have to look at your own sexual practices, getting involved with somebody. Do persons even say, well, let's go and get tested so we know our status? Do you practice safe sex? What is your thought process in terms of when you get involved in a relationship? So unfortunately,
Roleza, I think there's one more. But you said it's uncommon for people to say, let's go and see. But if you're an individual, you should still go. I think there's a certain amount of confidentiality that you will go. But if you find out you're positive, that's when you need to tell your partner. You understand? Because I'm still trying to emphasize that your partner may already be positive, but if you don't tell your partner and your partner isn't going to get tested, then that person will start to move on to get sick. Early treatment can really stop the progression. So telling your partner, darling, I something happened, I forgot to tell you, but I did cheat on you a year ago or some time ago, but I'm positive now, and I think you may be positive too. Please, let us do something, because even though you don't want to stay with me and so forth, I want to make sure your life is saved. I want to make sure that I love you, and I want you to live. And by you getting early diagnosis, you can live a lot longer, even though you don't live with me.
Sounds like you need to have mature people in a relationship. That's what it sounds like, Doc. All right, so we're going to have to end this segment at this time, and we'll be back with you for more commentary at 9:20 for our Talk to Us. But Activated Mornings is here with you. Time here in SVT.